Joe is, Joe and I have known each other since 2014. He was in the cohort below me out at Indiana State. He worked out at a small rural high school there, slightly over the border in Illinois. So you guys think time zones are hard here? Try living in one time zone and working in another. I couldn't do it. So props to him for being able to do that. And then has gone and is working near Philadelphia, is probably going to be the biggest city that anyone would actually know about. So yeah, he offered to come and speak with us today a little bit about his role working with some of the special education faculty. And he has a couple other roles at the school, so I'll let him introduce himself and then go on from there. Joe, I will have to give you permission to screen share because Zoom changed all the prereqs.
Yeah, I think they changed that in the waiting room, right?
Yep. Okay, so you are it, and I'm gonna pin you up so that way at least on it we can see it. So awesome. Well, thanks, Joe. The show's all yours now.
So, all right. So I'm going to share my screen here. I made a PowerPoint just really to guide the conversation and kind of start somewhere. But we can feel free to interrupt me and we can have conversations throughout. So I'm going to share my screen with the PowerPoint and then tell you a little bit about my background with this. Can everyone see that? Okay. So thanks, Dr. Neal. So Dr. Neal had posted on Twitter a couple weeks ago, just kind of asking for ideas. And one of the things I thought about was, what was something that when I started in my current role at my school, I wish I had known, So when I think back of things that I'm like, wow, as a student, I don't think I knew this part of a school. I think the biggest things were, really were like mental health and athletes and kind of how some of that stuff applies. And then just the general role that you have in the school as an athletic trainer, like being there during the school day. And so a little bit about me, like Beth said, I've known her since we were students at Indiana State together. Before that, I did my undergrad at Rowan University, which is in New Jersey. Then moved out to Indiana. Went to Indiana State, and then, like she said, I was working in Central Time Zone, so it was really weird. I used to tell people my commute to work was a half hour, or was a negative half hour, and then my commute home was an hour and a half. It was really weird. And then since then, I moved out here to Pennsylvania, closer to where I was from. We're a school district about an hour from Philadelphia, so. We're still suburban, but we start to have some rural, we're a really big campus and we start to have some rural students. The one thing about my school is that we're a public school, but academically we're a very high achieving academic school. So the stresses on our students are a little bit different sometimes, and our academic needs are certainly a priority, but we also have very competitive athletics teams. And so I started as the athletic trainer at the high school mainly. And then we kind of enlisted a new model as the district. We kind of moved to a 7 through 12 model, so 7th grade through 12th grade. And so now my current role is that I'm the head athletic trainer for the district. So there's 3 of us to serve our 7th through 12th grade athletes. And I'm also the athletics coordinator. So it's an assistant AD type role. So between those 2 roles, I've certainly seen more of the administrative side and some of the inner workings of the school a little bit more than when my daily role was strictly athletic trainer. So I still primarily do athletic training, but a lot more of my stuff is administrative based, and I kind of see that side of it. I'm also a preceptor at Westchester University, so some of my Westchester students might be on here because I invited some of my former students to come in. So that's about me, but feel free to, like I said, I'm going to go through just a few slides to guide the conversation, but interrupt me at any point. So I think just a general disclaimer, I will say that obviously this is my presentation. I'm not really presenting on behalf of my school. And also just a background on me. Like I said, I don't have a teaching background. I don't have a special education teaching background. But the one thing I thought is what's something that I really wish I knew about how secondary schools work, especially in regards to special education as an athletic trainer. So if you have any questions that are specific to policy, I might not know an exact answer, but I can probably get an answer if you email me or ask. But in general, this presentation is going to be more kind of how it relates to the day-to-day job of an athletic trainer. So when I thought about it, I was like, as a student, would I have really understood, why I should need to know this? And I probably wouldn't have, even when my last school was really small. It was about 300 to 400 kids. There just wasn't as much of a school-wide component, maybe because I was outreach at the school and I was only there for 20 to 30 hours a week, where at my current school, I'm a district employee and I'm there 40 hours a week, and I deal with middle school through high school and some of our district administrators on a daily basis too. So maybe I just know the need for this now, but I think the biggest thing with special education, or just in general, why you would need to know this, is that academic accommodations are like a key part to the return to learn process. And a lot of states now have, laws and protocols in place that kind of dictate that, but then everything kind of gets thrown for a loop when it's a student who's already receiving accommodations from a special education side, and then we have concussion accommodations. So sometimes, hopefully you work with a really good school counselor, or the case managers are really aware of concussions, and your school nurse is really good. But in some schools, the athletic trainer might need to be the biggest resource to kind of guide those people at, no, this is what the return to learn accommodations are trying to accomplish. So I'll go into a little bit more kind of how our school sets that up later, but it's definitely a key. That's probably the most important way that academic accommodations play into a daily athletic trainer's role. And then a little bit about, 504s and IEPs are two legal documents on the special education side, which we'll define here in a couple minutes, but they can sometimes influence what you need to know in in an athletics event, and kind of it determines what school personnel is required. So I'll go more into detail about those in a little bit. And then ATs, like I said, you're asked to collaborate with other departments in the school, and it's just really important for us to kind of speak the same language. If we're saying something, just as simple as if we're saying oh, they need to do a modification, we need to modify that. Well, in the academic world, a modification is different than an accommodation. So sometimes it's just using the same words that they're using, so that they don't brush off your input immediately. Then another way where I think this interacts is, and especially at our school, we have a unified bocce team, which is run kind of as a joint program between the school, Special Olympics of Pennsylvania, and the PIAA. And we have an annual meeting kind of with the case managers and PCAs and our school nurse, just to kind of go over that population's unique needs. So real quick, what does the research say? I'm not going to bore you with a ton of this, but there's not a ton of research really on this from what I could find, but there is a lot of stuff on academic accommodations following concussions. But I thought this was pretty interesting that, in general, this is a statistic from the government, but 14% of public school students receive some sort of special education services. So what that realistically means is that if you have a football team of 100 athletes, 10 to 20 of them probably fall somewhere in the special education services. Now, it might not influence their athletics participation, but it might be something that you then want to know once you are in, a situation where you're dealing with accommodations. And then I thought this was really interesting. Athletic trainers employed by school districts themselves, such as myself, as opposed to an outreach, which was my past position, are more, they just have a higher knowledge of the academic accommodation side of it. And again, I think that goes to speaking the same language. And then this was an older study. It's about 11 years old now, but this goes into the special educational or Special Olympics a little bit, but athletic training program directors reported that most did not feel confident working with Special Olympic athletes. So again, that's a small subset of special education students, but it is a caveat where a lot of athletic trainers are working in Special Olympics. And I know actually my first role as a certified was in 2014, New Jersey hosted the National Special Olympics Games, and it was 3 weeks after being certified and graduating, I was working this major event, and it was really well done. It was really well organized, but it really opened my eyes to kind of communication and some of the things that it's like, wow, I never actually learned this in school.
I have a question.
Yeah, of course.
On that last slide, if you go back for
Yeah.
do you think the ATs employed by school districts help more with like school knowledge? Because first question is, do you guys have more meetings with like educators and things like that as an AT employed by the school district versus outreach?
That's a good question. I think if I really think about it, those numbers could be skewed a little bit because there's still a large portion of the country, mainly Texas, where I think a lot of athletic trainers that are employed by school districts are also teachers and are also teaching, whether it's a sports medicine class or a health and PE class. So maybe that number is skewed a little bit because there's athletic trainers employed by school districts that also function as a teacher a little bit. But I think just anecdotally from my own perspective, I'm certainly viewed as someone more in the school community, and teachers and our administrators are more willing to talk to me. And I am expected to be at some staff meetings. I don't go to the ones that are mainly education based, but I'll go to our preschool staff meetings and some of our other staff meetings. And I think I'm just more visible to teachers than maybe an outreach position. And I will say our school is a little unique in that there's, of the three of us, two of us are employed by the district. One's primarily at the middle school. I kind of am with everything, but my office is at the high school. And then we have an outreach position that's mainly with the high school. So I think if I look to, my role versus that role, I think maybe I go to more meetings than the outreach person does, and I'm kind of more visible to the school. So maybe that could be it. But that's a really good question, because there really wasn't a like breakdown of why or really the different roles that they were employed in. I think I'm trying to look up. It looks like there's a few things in the chat, but I don't know how to get to it. So if someone, oh wait, I got it. Oh, it's just people saying where they're from. Okay. So again, if you have questions, just shoot them out. It's probably easier than the chat. But just real quick, just so that people know that there are some, legal obligations that not necessarily you need to be directly familiar with, but your administrators are certainly familiar with these at a secondary school, and they would need to then, make sure they're following them. But there's really those top four are really the three, or those top three are really the three laws that really guide special education and students with disabilities in school districts, whether it be physical or special education. And then the applicable kind of rules are that the NFHS, their rule is kind of that if you can have rules, interpretations, and applications that apply a reasonable accommodation, the school district has to do it. So the courts have kind of ruled on that it's the legal duty of the school to provide a reasonable accommodation. And really when that was broken down in the article I read, it was, can the activity still be done safely? Or when you make that accommodation, is it now a different activity that increases risks to other people? Is it an undue financial burden? I mean, if you had to redo your facilities entirely to accommodate that sport and then make it theoretically a different sport, then you're really altering the activity. And then the biggest one, I think I kind of already touched on this, maybe by merging some of these, but if you're not putting other participants at risk. So if other participants are at risk because of a student participating, I think that could happen, in a field sport. If someone in a wheelchair was going to participate, there might be a safety risk to other participants. So I think that that's kind of where the courts have ruled. And again, that's not ever really the athletic trainer's decision to make, but these are kind of things that would guide your administrator's decisions. So this was just I forget what they're called, like word chart that I forget what these are called, but word chart that I kind of put together with just terms that, if 3 years ago when people threw these terms out, or 4 years ago when I started at my school, it was like, what do all these like little abbreviations mean? So I'll go down through some of them on other pages. So just some key terms right now. If someone uses the term academic accommodations, they can be short-term and informal. That should say informal, not informed, but they can be informal. Concussion return to learn protocols are very often, a doctor's note, and then the teachers kind of follow them. Or accommodations can be very formal. in the form of an IEP or a 504. And like I said, an IEP it stands for Individualized Education Plan, and the 504 it's based on the one law that was on the previous slide. You know, the Rehabilitation Act of 1973, that's dictated at Section 504 of that act. So those are both legal plans. IEP are to make sure that students are receiving specialized instruction and services, and the 504 is that students who don't qualify for the IEP, but it's making sure that they have an appropriate learning environment. So some examples for a 504 would be, you know, I'm just thinking of some of our athletes who have them. You know, we have a diabetic athlete who has a 504 that, you know, allows him access to the school nurse whenever he needs to, and access to bathrooms whenever he needs to. And if he's absent because of a doctor's appointment, he's allowed to, he's then allowed to make up a test versus someone who had an unexcused absence type thing. Also in 504, sometimes it'll dictate kind of what personnel has to be present. So we always kind of have this debate whether, you know, we'll have an athlete who has diabetes that's pretty uncontrolled, and it's, you know, in their 504 it says that for all school activities, including field trips, they need to have an LPN present if the school nurse isn't present, which is another form of a nurse. So they have a one-on-one nurse essentially with them for field trips, and then it comes up, well, if they play sports, you know, what do we do for home games? And this is where the relationship with our 504 coordinator has been great, to be able to say, like, well, athletic trainers are trained in the management of diabetes and can administer glucagon in an emergency. So they've started to write in some of the plans that for home games, you know, the athletic trainers, okay, we don't need a nurse there. But then for away games, it goes into, well, who's doing this on the bus? Do we have a legal responsibility on the bus? And so anytime an athlete really has a 504 that has a personnel issue attached to it, whether it's they're going to have a nurse, or whether they have an IEP that requires them to have a PCA, those conversations usually have to involve our administrators, whether it's our principal, it's our director of special education, it's our 504 coordinator, or our director of pupil services. But those are always bigger meetings that have a couple people in it, and sometimes parents are like, listen, at away games, like I'm always going to be at the away games, and they'll rewrite the 504 to say, you know, at an away game a parent will always be present that can administer, or they'll rewrite it to say at an away game the plan is to call 911 immediately. So it all depends really on the individual. Well, again, they're all individualized, so it really depends on the individual and what the administrators kind of decide. But it is a really important thing to know early on, because that's a extra documentation and extra planning on those athletes as to what you should have to follow. Some other key terms that I really didn't necessarily know when I started, but IST is instructional support team. Where that really comes in is that sometimes our student athletes, if they need academic accommodations beyond 90 days, we start an IST process with them. So just to see if the student then qualifies for special education, or if other interventions are needed to kind of maximize that student to succeed that year. Because if you're receiving accommodations, especially if it's no testing or something for 90 days, that's a significant portion of the school year. It's essentially almost a third of the school year. So what can we do to make sure that student isn't going to have to repeat classes and is still going to be eligible to move on? Case managers are teachers, but they are assigned to oversee a student's education and ensure that the IEP services are implemented. And usually they're in charge of a specific program. So you'll have like your special education teacher who does emotional support, or your special education teacher who does life skills, or some of the other subsections, which are on later slides. And then a PCA is either a one-on-one or a one-on-two aide who works with students. So they're personal care assistants. Sometimes we call them paras for paraprofessionals, but they directly support a student with one-on-one aid throughout the day. And then again, certain athletes need a PCA for athletics. Certain athletes, you know, don't need a PCA for athletics. And not every special education student has a PCA, obviously. But again, if a student does have a PCA, that's a larger conversation with our administrators to, you know, can this student participate daily without their PCA there for athletics? So here's just, I'm not going to go into them too much, but there are a bunch of different subsections and programs of special education. So here are those that we support. And so as a district, and some of ours have to be outsourced, but as a district, we have a large special education department. So different levels, again, I'm not going to go into them too much, but there are, different levels. So of that 14%, there's some that only qualify for services 20% of the day. Some qualify 20 to 80%, and then some are full-time special education services throughout a whole school day. So really, I think this slide's really important. I've always kind of had an interest in interprofessional collaboration and studies and whatever you want to call it, because that's what my thesis was on in undergrad, or in grad school. It was on interprofessional collaboration with physicians and athletic trainers. But I now see, now that the more I talked about interprofessional education and collaboration, that there's this large subset of professionals that maybe aren't even necessarily healthcare professionals, but they influence, the day-to-day care of a student or a patient. So really, on the team in a school, you have your special education teachers, and then your general education teachers, the case managers, which again are the special education teachers who are then ensuring for that athlete that their IEP is there. Maybe there's PCAs, there's school administrators. I'll say in our school, we have, at our district level admin position, we have a director of pupil services who kind of oversees all of special education, school nursing, guidance counselors, all that stuff, the wellness committees, the social emotional learning committees, that type of stuff. And then we have a director of secondary special education, or a supervisor of secondary special education, a supervisor of elementary school special education, and then a district 504 coordinator, a couple school psychologists, and then each school has a psychologist, and then each school has a social worker, and obviously a bunch of guidance counselors. And then each school has a school nurse. And then in addition to our everyday school nurses, we have a bank of LPNs who will contract with another company, again, for field trips, or if a student needs one for a sporting event or something, who, they're paid hourly for whatever hours we contract them for. Then you have occupational and physical therapists who are usually outreach positions, but they'll work with some of the students on a daily basis if they qualify for those services on their IEP. I'll say one of the things this year that I wasn't thrilled about it at first, but now I view it as a good opportunity to collaborate and kind of be seen as a larger picture of the school, is that the school physical therapist, the new one who we've started using, uses our athletic training room every Thursday morning to see her patients and the students that need her. It's been an interesting perspective to kind of see her work in the same position that I am. And most of the students she works with are the athletes who are, or the students who are also athletes in our bocce program. So it's interesting to see those students kind of in a different way, even though I'm not really working with them, but I'm in proximity to it. And then again, school psychologists, IST, and 504 coordinators. In our district, we have a position that really kind of my branch, I guess, into this department, is that we have an IST coordinator at the high school. Again, that's that instructional support team. And her title is IST coordinator and concussion case manager. So she handles all of the academic accommodations from a concussion side. And at first, she really didn't have a background in concussions. Her background's really in education and this stuff. So there was a lot of collaborating back and forth and teaching both ways about how the process kind of works. So some 504 plan considerations that could influence athletics is, if you have a diabetic and it says that their glucose and glucagon testing supplies and their diabetic kit always has to be with them. That's something that really should be on the coach's radar. One thing I started doing this year, maybe this is a little subtopic, this isn't a 504 thing, but I found it's actually pretty helpful, is student athletes who I know have an important item in their bag, whether it's a diabetic kit or whether it's a EpiPen or an emergency inhaler that they might need. We have like simple like carnival bracelets, or you might get them if you're at a club, or like the bars will give them out, like those types of things. We just bought a pack of 1,000 of them. They're all blue, and we just tell the athlete to put it on their backpack. And the reason for that is if I have an emergency, the last thing I want to be doing is like, does anyone know who Johnny's backpack is? As opposed to just being like, all right, it's got to be one of the three that has blue, like a blue band on it. And for the most part, no one's really giving me a hard time about it because there is a privacy factor to it. You know, no one really knows what the tag is unless, I guess, in theory, you're one of the other students with the tag, and then you might know. But for the most part, it's just kind of a discreet way to identify a bag up front. And whether those athletes then switch a backpack, I don't always know. But it's at least some way to kind of hold some accountability to knowing which bag is theirs. Again, we have an athlete with epilepsy who has a 504 plan, and he has emergency medication that we store in a locked cabinet in the athletic training room. It's like a DEA approved lock cabinet, and his 504 plan talks about when that should be administered, and then from there, me, the school nurse, and his parents and his primary care doctor work every year to develop an action plan. So it's pretty simple now that it's been made, but at what point do we use the medicine? At what point do you call 911? At what point do you not call 911? At what point, if an athletic trainer or a nurse isn't there to be able to help assist in administering the medication, what do the coaches do for an away game? So sometimes an athlete with a 504 then requires an additional action plan that the nurse might have for school. But again, sometimes it's really important as the athletic trainer to have the conversation to say, like, well, what do we do at 5 o'clock at an away game? Because the one thing I noticed working in a school district is that most people's mindset whenever something comes to school is 8 to 3. And then it's like, as soon as you say, like, well, what do we do at 4 o'clock? People are like, I don't know. So sometimes it's a really good reminder to say, like, well, let's make sure we have a plan for what happens after school. And then again, I think I talked on this a little bit, but requires what personnel are available during events. And the one nice thing sometimes when you have an athlete who requires an additional person is that it forces the coaches to really stay to a schedule and communicate it really, really, really well. Because now, there's another person traveling with their team who is influenced. And in theory, we would be, if a coach said, all right, actually tomorrow, instead of leaving at 10, we're going to leave at 9. And we didn't inform the nurse that's traveling, we would have a huge liability if something happened. So the biggest thing with them is communication, working early to get a plan in place. So what we'll do is on the first day, once we kind of know everyone that's tried out, we'll email our 504 coordinator the first day of fall, winter, or spring sports and say, here's everyone who registered for spring sports. Please put anyone on our radar who has a 504. And she'll send us a list of, at first she only sent us ones that were relevant. And then, there was kind of a collaboration that said, like, everything's really relevant. Because again, going to the point at the bottom, if someone has ADHD or a learning disability that influences their 504, it's really helpful to know, during impact testing or interactions like that. Some IEP considerations, these are not, in my experience, they don't influence really as much. They don't really have a day-to-day impact on athletics as much as 504s, and they don't really come into play as much. But again, someone who has a concussion, like, instead of emailing our concussion case manager, we'll also email their individual case manager if they have an IEP. And then post-concussion syndrome, I was just invited to an IEP meeting a couple weeks ago with our, in an IEP meeting, there's a general education teacher, an administrator, the secondary a secondary school administrator, the school psychologist, the occupational therapist was there, the school nurse, me, his parents. So it was just a big meeting to say, it was mainly geared towards academics, but they kind of invited me for the opinion on, well, how do we handle PE for this athlete who has accommodations to only do aerobic activity during PE? So what can we kind of do that he still gets PE credit and doesn't need to repeat the course in the future? Again, sometimes learning support, which is a class where you're working with a teacher, is instituted if students miss a long period of school, just to kind of catch them up. And I think we've talked about this a lot, but with PCAs, it's important to really build that relationship because they probably know that student better than anyone in the whole school, especially if it's a student with emotional support. So we have a student this year who has a PCA for the school day. He doesn't have one after school, but if something goes wrong, it's really nice to know. He wrestled this year and his PCA was a basketball coach, and it was really nice to be able to go into the basketball gym and be like, hey, so-and-so really needs you. Can you come out? So just knowing who their PCA is every day and knowing whether it's going to be the same person every day at athletics is really helpful. And then really encouraging your coaches to talk to that PCA so that they can provide really what's best for that athlete. We have a student in track who, if he did the workout with the team, it probably would hold up some of the other team members because of the pace he does it at. So the coach will really work with the PCA to be like, hey, here's the workout today. Here's what I think he could do of it. If he falls a little bit behind, can you catch him up or figure out which one to skip and kind of do that? So it's a really important collaboration there. And again, the physical therapist, if a student is hurt, it's really nice to work with them during the school day so that they know what we're treating after school and what they're treating during school. Again, this is such a very small portion of special education, but I think it's a big portion because it is athletics, and it's getting more and more common for schools to host these unified programs. So unified programs are partnerships between Special Olympics athletes and partners. The partners are regular education athletes who are then paired up with special education athletes to make one team. So for bocce, we'll have teams of 8, and 4 are Special Olympic athletes and 4 are regular education students. And it goes very hands in hands with Best Buddies, which is a club that kind of does a similar thing. And here in Pennsylvania, the Special Olympics of Pennsylvania and PIAA partner to make 3 sports: track, bocce, and soccer. In my opinion, locally, most schools really only sponsor bocce right now, but hopefully that will grow. And then this picture on the side is just from our school. It's everyone's favorite team, but they got a front page spread in the paper this year. So that was really cool. And then just going back to this, if you are working a Special Olympics sport that's not associated with your school, so again, that's not really in the scope of what I was talking about here, but it's a good point. Their coaches, the coach ratio, I think, is like 4-to-1, 5-to-1, something like that. So it's really important to lean on their coaches. They know the athlete best. They know that, oh, this is something that's really serious right now, or this is something that he or she needs, 5 minutes, and then let's reassess. If you ever get the chance, Dave Salon is an NATA Hall of Famer, and he's an athletic trainer in New Jersey. I fortunately knew him when I was a student, and that's how I got involved with the National Special Olympics games when they were in New Jersey. He had a phenomenal presentation. I think NATA, maybe 6-7 years now. But if you ever see him presenting on Special Olympics and athletic training, you should attend. It's really well done, and he's one of the national experts on Special Olympics healthcare. So if I really had like one take home from this, my biggest take home is you have to be proactive and communicate and collaborate with the school personnel outside of athletics before you need them. So the better relationship you have with your school nurse and counselors, the easier it is to go to them once you have a situation that you really need to talk with. And then these were just some of the references that I referenced throughout. But again, that's really what I had just to kind of start the conversation, but I just kind of want to hear what your thoughts are and what your questions are. So.
What percentage of your day working would you say is athletic training based versus administration based? You muted yourself,
yep.
So I can't hear
Sorry.
you.
Depends on the season. I would say my role now, in the fall, it's probably about 70% athletic training, 30%. I'll say it's about 60% athletic training, 30% like scheduling and like truly athletics admin stuff, and then 10% of stuff where I'm like, I'm not sure which one this would fall into. Whether that's collaborating with our athletic director on, setting up a large scale event, or we tend to host a lot of cross country. So there's a lot of meetings where I'm in the planning committee meeting with the booster clubs and the coaches for how we're going to plan this event. And I think I'm truly invited with my athletics coordinator hat on, but it's really nice to sit at that table as the athletic trainer and say like, well, where's the medical tent going to be? And how are all the people on the course, the marshals, going to know who to call in an emergency? So there's a lot of things that kind of overlap that I'm like, I'm not really sure what role I'm wearing, right, or what hat I'm wearing directly. But it's a good hat to wear. So.
And when you applied for this job, was it posted that you would be kind of like an all around like administrative at ATC, or you went in thinking ATC and they said, hey, we need you for this stuff too?
Yeah, so I applied for the job out of grad school from Indiana State in 2016, and it was posted as athletic trainer. And so when I had posted, I thought I was going to be the sole athletic trainer at the school. And when I showed up for the interview and read the job description, it was really nice that it said, in charge of supervision of assistant athletic trainer. And I was like, oh, that's awesome. Like here I was applying for a position where I thought it was just me and I'll have someone else with me. And then during the interview, on the interview committee was the middle school athletic trainer. And I was like, wow, this is amazing. There's going to be 3 athletic trainers here. My first year, I was truly just athletic trainer. And we were really separate departments. The middle school athletic trainer helped a little bit at the high school, but for the most part, I had no interaction with anyone at the middle school. My second year, this district kind of shifted, and at the time there were 2 separate athletic directors. The district kind of shifted and hired 1 supervisor of athletics for the whole district, and kept on the middle school AD that first year. And they still were kind of run as 2 different departments. And then that second year, they turned the middle school AD position into like a game manager position, and kind of opened up that middle school AD role to be more of a 7 through 12 administrator, and then offered me kind of the position. So last year it was a supplemental, which is like an additional duty, which you're paid for obviously on a small contract. And then this year it turned into, I'm now a 12-month employee, and it's my whole job description was kind of rewritten by me and our AD to kind of encompass everything.
So knowing the information that we know now, do you recommend, like, if we are wanting to work at a secondary school, to, like, when we have our interview or we get hired in, to automatically go in and ask about this stuff, like if any athletes have a 504 plan or anything?
I think I come into a very established school that has very great communication amongst departments. I could see at my last school I would have gotten, and it was a great school, don't get me wrong, but I would have gotten a little bit like, why do you need to know that? So I would say the first relationship I would build, if there's not really a great relationship between some of those other administrators who aren't necessarily involved in athletics, my first relationship would be building a relationship with the school nurse, and really getting him or her to know everything that you do and why you do it, and truly view, if they don't already view it as a partnership in healthcare, to view it as a partnership in healthcare. And then even now, my school nurse is outside of my athletic director, is probably the most important person that I know in the school, from like a relationship and getting things. Like if I really need something, she can find it out for me. And she's not necessarily, she views me as another healthcare provider in the school. And unless something's really confidential, she's not afraid to give me the real reason of it. I think that happens a lot where, I'll give an example from this year. We got a note that said, like, student athlete was hospitalized for 2.5 weeks. Cameron's turn to sports is tolerated. And you're like, what does that mean? Like, what do I need to know? And I think in a lot of schools, it would be like, don't worry about it. Like, it wasn't a big deal. And me and the nurse were able to have a real conversation that this was a student athlete with an eating disorder, that triggered this, that triggered this. She's been cleared by these professionals, but still keep this between me and you. But if something happens, you now know if there's an emergency. So I think that's such an important partnership.
So, like, going based off of that, then would you also try to have a relationship with the school psychologist, or would you mainly take that through like the AD or the nurse, and then they suggest it that way?
I think some of it's playing on the relationships that are already there, and kind of figuring out who everyone is. It might be a situation where your school nurse can provide all that for you, or in our case, our office manager for athletics is amazing, and she's one of those people who, when you need to connect with someone, she's built relationships with everyone in the school and can really like, oh, here, I'll walk you over to so-and-so's office, who's this person who can get this for you. So I would say kind of figuring out who your biggest ally to get you into those conversations with people. Because I think sometimes you don't want to you want it to be very informational as to why you need to know that information versus someone to feel that you're just being nosy. I think that you don't want someone to be like, are they just being nosy because they want to know, as opposed to being like, no, there's a medical need for me to know. So I would say try to build that relationship, but if you can't, use your other relationships to get that information. And I would say one of the biggest things that could help, I didn't really even know what this was, but when I first started, they were like, oh, do you feel like you need a Power School account? And I was like, no, like, what is that? And then our office manager was like, you need a Power School account. And so it's really helpful. It's like the school, for those of you that don't know, it's basically like the school record system. So it has student schedules on it, all their contact information. It has a picture of each student that, if you're like, I'm not sure who I saw. Did I see Johnny or did I see Jimmy? And you can pull up a picture of both of them and be like, oh, that was Johnny that I interacted with in the hallway before. But it also has an indication whether students are a special education student, who their case manager is, if they have a 504, and then go from there. So I can't necessarily open the 504 or the IEP from there, but I can see that a student has it. And most of the time, if I'm looking at someone's physical and it says that they have type 1 diabetes, and then I look at their Power School and it says that they're a 504 student, well, then I know between the two, that's probably what it's for. And then I can approach the relationship or approach the conversation with our nurse or counselor by using that information that I already know.
Joe, I have a question for you. So you talked a little bit about some of the time that you did get to spend in Special Olympics, and you talked a little bit about like getting to know the coaches a little bit more, because they know the athletes better than a lot of people do. Could you explain kind of what that means if anyone hasn't worked Special Olympics? Because I don't know, has anyone actually ever been able to be a part of the Special Olympics?
I was an undergrad. I was just kind of helping people, like helping the athletes like practice for their Special Olympics, but it was never like actually at the Olympics.
In high school, but obviously not in any sort of athletic training role.
Yeah, because this was something that nobody prepped me about, and the first time I worked it, it was very, very surprising for what to do.
Special Olympics is one of those things that I feel like it has its own dictionary, and until you've worked a few events, you don't really know what people are talking about. But there's a few distinct roles. There's participants, which are the student athletes or athletes. I shouldn't say student athletes because it might be non-school related. There's partners, which again are the students without disabilities who are partnering for a unified project. And then there's coaches. And I think when I hear coach, just because I think of athletics, I think of, like your head coach. But really coaches are more of like that's probably not the correct term, and probably insulting if like a Special Olympics coach was right here, but they're almost like a chaperone or friend to the students, or to the athletes. So they'll be paired up in, there will be a team of 20, and of that 20 on the soccer team, there will be five coaches or 4 coaches, and there might be one person who really leads as like the head coach. But for the most part, each one of those coaches kind of has individual students or individual athletes who they kind of work with. And so they've really worked with them all off season, probably for years if they have a really good relationship and an established program. And so those people know everything about those people. So when someone, gets kicked in the shin and they're laying there screaming and crying, they might be like, this person does this every game. Like, we just need to give him 5 minutes to just like breathe, get him a drink on the sideline. I'll tell him he's okay and he'll be okay. And they're not like shooing you away, but sometimes they know that certain athletes are doing it for attention, or it's probably, again, not the best way to say it, but overreacting versus they're actually hurt. So generally you'll be like, okay, like if that's what that person's saying who really knows this person, like let me hang around to obviously make sure that's what it is. But 99% of the time in my experiences, that person's dead on accurate. That they'll be like, in 5 minutes he'll be back playing, and then you're like, okay, I mean, it looks like he sprained his ankle. And then in 5 minutes the kid's running around and you're like, oh, I guess that guy was right. Like, So really lean on the coach's expertises. Obviously, if it's an emergency, like do your thing. But if it's an acute, one of those like minor acute injuries that we're so trained as athletic trainers to like rush to and be like, oh, what do you need? What do you need? Just giving them a second to really compose themselves, think of their thoughts, and getting someone who really knows their opinions. Quite frankly, it's really the same. Like if I work a youth camp, like with really, really young kids, their parents are usually the same. They'll be like, no, this kid's fine. Like I know my kid. Like he's the boy who cries wolf, or he's the whatever. So quite frankly, it's the same approach, and it really forces you to work on your communication skills.
Awesome. Any other questions for anyone?
It can just be about secondary school athletic training too. I mean, it doesn't have to be directly about this, but.
Well, I obviously have Joe's contact information, and he's offered that if anyone has questions, I can have you guys reach out to him directly for some questions if you think of it afterward. So I do just want to say thank you so much for your willingness to come chat. This was really helpful information and stuff that typically we're not really exposed to a ton, either in all like the secondary schools we work at, education and everything like that. So thanks for taking some time to come.
Thank you. Thank you.
Awesome. So it's good to see everyone. I'm gonna go ahead and